Good afternoon, Dr. Gary here on the road. We sell dental practices nationwide. Today's topic is what happens when the seller of a dental office becomes an associate. We're going to get into that. So we're in 27 states now and growing. Off to Texas this week. Should be interesting. We'll keep you posted what happens there. Seeing some nice practices. Then we now have 10 employees, including 2 CPA accountants, marketing director, a operations director, and 5 development acquisition people, specialists. We're excited. We hope to keep growing. We're also going to the DEO Dental Entrepreneur Organization kickoff seminar conference this week also. So hopefully we'll find some newer buyers that are up and coming that eventually will be selling. These are usually groups from 3 to I think 10 sizes that eventually are going to be selling, and that's going to be interesting. So we hopefully bring new sellers to the marketplace. All the information you're about to hear is for entertainment purposes only. It is not legal or business advice. Okay? You could reach us 363 days a year. We only take our Christmas and Easter. Our phone number is 201-663-0935. And our website is dentalpracticeguide.com. So look it up with a lot of great information on there, plus blogs and so forth. And you'll find out everything about us on that. So let's get into today's topic. What are the obligations of a seller who then becomes an associate? I assume everybody understood what this was and what happens, but it's just today I learned after all these years, certain sellers don't understand. You, as a seller, become an employee. You're an associate of the practice. You don't have any overhead obligations to the practice. You're not involved with the rent. You're not involved in hiring or firing. You're more of a clinical associate in that respect, not management. Although it's always nice if you could help, especially when it comes to issues at the office and etc. And new employees, putting your input with that, making a decision on a new piece of equipment. But you don't have that responsibility of overhead. You're not paying the rent. You're not paying the salaries. You're not paying benefits. You are strictly an employee, because one of the doctors called and says, do I have to pay any part of the rent? Of course, it did explain how the labs work. Every office is different. The employee associate's now paid somewhere between 30 and 35% as a GP of either the gross collections or productions. Every office is different. And then the lab cases are sometimes, if let's say it's a $2,000 charge for a crown and $100 for the lab, they'll take the $100 out, and then you'll get your percentage off the $1,900. So that's how that works. You're strictly an employee. You don't have overhead responsibilities. I hope this clarifies this, because frankly, a seller of a large practice didn't realize this, and I guess I failed to explain it. So therefore, I'm explaining it in detail now so you understand what the story is. Okay, that's how that works. But it's a great opportunity. A lot of the doctors who sell their practices become an associate of the dentist that sold. Enjoy it more because they have no responsibilities as far as the office, the management, the finances, the mechanical, if something breaks down, the equipment purchase, employee quits. They don't have any of that responsibility, and they enjoy it and they work for a period of time. But as an associate, which you become, you are considered an employee with minimal, if any, responsibilities for the overhead of the office and management of the office. So just if you have more questions on this, let us know. Also remember, if you are large and selling to a DSO, please call us. We do not charge you as a seller if a DO purchases, because the DSO that we bring pays our commission. Okay? So let's talk. Give us a ring. Remember, sometimes we can get the legal fees reimbursed too for the seller upon successful closing. So give us a ring. We'll talk about it. Great talking to you. Looks like a great beach weekend, but we are off to Arizona and Texas. We're going to miss a New Jersey beach day. I'm kind of bummed, but what can you do? We'll catch up in the wintertime somewhere. Thanks. Bye.